Thanks for joining us for this special edition of Talk to Your Health. I'm Dr. Derek Da Silva. This afternoon, we've got a panel of experts answering your questions on Ebola and Enterovirus D68. The number to call, Chilton Memorial Hospital. Also here with us is Patricia Whitley-Williams. She's a pediatric infectious disease specialist at Rutgers Robert Wood Johnson Medical School. Let's start with Ebola. The latest news, healthcare officials have confirmed a second hospital worker in Texas has been infected. She's a third person diagnosed on U.S. soil. News 12 New Jersey's Eric Langstromer has more on the deadly virus.
It's a virus spreading throughout West Africa. More than 4,000 people have died, and now Ebola is causing panic here in the U.S. The issue made national headlines in August when 2 Americans infected by the virus were flown to the U.S. for treatment. Then last month, doctors diagnosed the first case on U.S. soil. Texas patient Thomas Eric Duncan died days later. One of the nurses who treated him contracted the virus and is now being treated. And just today, news that a second Texas healthcare worker has also been infected. Fears over the spread of Ebola are everywhere, but just how likely is a massive Ebola outbreak in the U.S.?
So, Dr. Whitley-Williams, how likely is this massive outbreak? How likely is this to happen?
It is not very likely. We have known about Ebola for many years. It has, as you just reported, it has just struck our soil. However, it is very unlikely that there will be a massive outbreak. We know how to contain this disease. It has been contained before in the Western African countries in which Ebola has had several outbreaks. So we know we can contain this.
And the other virus that we need to be very concerned about and parents need to be worried about is the Enterovirus D68. News 12 New Jersey's Eric Langstromer explains.
Enterovirus D68, the potentially fatal respiratory illness, has sickened some 700 people around the country, almost all of them children. Here in New Jersey, parents are on high alert after a 4-year-old Hamilton boy became infected with enterovirus and died. His death earlier this month marked the first one in the state, but the D68 strain has sickened more than a dozen New Jersey children. Health experts say children with pre-existing medical conditions are especially vulnerable, but perfectly healthy children can also become infected. Now, many parents are left wondering, how can they protect their children from Enterovirus D68?
So, Dr. Devidan, let's go right to you as Eric finished that package. What do we do? How do parents prevent their children from getting this virus?
I think the best thing is to practice respiratory etiquette and hand etiquette. And respiratory etiquette, what I mean by that is learning how to cough and sneeze into your arm instead of into the open air. Hand etiquette, learn hand washing for at least a good 20 seconds of soap and water. And if someone is coughing, kind of stay away from them, at least more than 6 feet away.
And Dr. Williams, you know, a lot of people, I think, now are aware of some of the symptoms of Ebola. Can we go over what some of the symptoms of Ebola are? What do we need to look for?
Certainly, those symptoms include fever, chills, sometimes body aches, weakness. Also, you can have a headache. And then following those symptoms, maybe 4 or 5 days later, one can experience vomiting. And then you continue to feel just worse and worse, weaker and weaker. And the bleeding out that so many people hear about is something that occurs much later in the course.
We're taking calls, folks. As you know, the phone number, once again, is 1-888-NEWS-12-NJ. We've got a caller from Rahway. I believe it's Denise. Good afternoon and welcome to the program. Hi, Denise. What's your question? No, okay. Anyway, we'll get her back in just a little bit. So, you know, this is something that we all have to be just very concerned about, whether we're talking about enterovirus or whether we're talking about Ebola. What Dr. Devidan said just now is, I think, extremely important. The basics need to be done. What else can we do? Do we need to wear a mask when we go to the mall? Do we need to wear a mask on the plane? Should we carry some gel to clean our hands with? What are your thoughts on that? I'll come to you first, Dr. Whitley.
Certainly. It is common sense. I cannot emphasize enough good hand washing. That's the best thing you can do. And certainly to sneeze into your sleeve, your arm is also very important. And if you have a respiratory illness, if you have fever and so forth, stay home. Do not go to school or to work, because you're going to infect the rest of your coworkers and other children at school. I know that's not always possible, but if it can be done, that's probably the best thing to do. Eat healthy, get plenty of rest, try to be as healthy as you can. Protect yourself when you can. So for instance, we're about to enter influenza season or flu season. Get a flu shot. That's going to help. And some of the symptoms are a little bit similar in the beginning of flu as they are with Ebola. So if you get a flu shot, hopefully that'll protect you from getting the flu. So it's really common
Just the basics. Just the basics. Use your head.
Yes, and you can carry a little of the
hand sanitizer. Why not?
Certainly. Before you eat, certainly use it. When you come into the house, use it. If you go to a hospital facility, use it before you enter.
Bathe in it if you go to a hospital. You know, that's more important. Let's go to the phones and let's take a call from Rockaway, and I believe Becky's on the line. Becky, good afternoon and welcome to the program.
Hi.
Go ahead. What's your question?
My question is, if an infected person with Ebola is a butcher, he's handling meats, and say it's in like a ShopRite or a Pathmark, and then he packages up the meats and puts it on the display, how long would the Ebola virus live in the packaged goods?
Well, I think the first thing we have to clarify, and you're referring to, and you two can both jump in here, is the fact that the transmission, one of the modes of transmission, is by eating raw beef, and that is, you know, in Africa. But we don't really do we need to be concerned about something like that here, Dr. Williams?
Not so much eating raw meat, but certainly the contact with the body fluids or secretions of someone who is infected with Ebola. And remember, those that happens when people develop their symptoms.
But what are the chances of something like that happening here?
It's what we call a theoretical risk. It's pretty far-fetched. More than likely, there's going to be direct contact. It's human-to-human transmission.
Right.
Human-to-human transmission.
And what about with enterovirus? Is there a relationship with what Becky just asked with regard to enterovirus?
I mean, with the enteroviruses, it's more passed on by respiratory droplets.
Right, so it's a cough, those
is.
type of things.
And you have to remember, like, we average about 10 to 15 million cases a year with the enteroviruses. Some have symptoms, some don't. Some have just cough, cold symptoms. Except this strain is just a little bit different, and it attacks a little worse on certain people versus others.
What we're going to do is we're going to take a short break, and when we come back, we'll have more of your questions on Ebola and enterovirus right after the break. By the way, if you'd like to join us, our phone number is 1-888-NEWS-12-NJ. Stay with us. Welcome back to 12 to Your Health. I'm Dr. Derek De Silva. We're answering your questions today about Ebola and enterovirus D68. Joining us today is Dr. Philip Devedin. He's a pediatric emergency director at Chilton Memorial Hospital. Also here with us is Dr. Patricia Whitley-Williams. She's a pediatric infectious disease specialist at Rutgers Robert Wood Johnson Medical School. Thanks so much for joining us. We have a caller, so let's go right back to the phones in Rahway. I believe Denise is back. Denise, good afternoon and welcome to the program.
Hello.
Hi there. What's your question?
Well, I just wanted to know if oral rehydration treatment is effective in the treatment of Ebola and also the neurovirus 68.
Did you got the question, oral rehydration treatment?
Yes, I did hear that. So the amount of fluids that are lost in a patient who has Ebola infection is tremendous. So oral rehydration would not work. A patient with Ebola can lose up to about 10 liters of fluid a day, and it is a heroic effort that requires intensive care management to replace the amount of fluid loss that occurs with Ebola.
And
so no.
And Dr. Devidan, what about for the enterovirus?
You know,
Oral?
with this strain of enterovirus, it really isn't presenting with vomiting and diarrhea. It's more respiratory symptoms. So not so much. What we tend to do is the ones that present with wheezing or respiratory problems, we tend to give them oxygen and nebulizer treatments.
So what about some of the symptoms of the enterovirus D68? What are some of those symptoms that people need to look for in children?
Sure. I mean, some of the milder symptoms that we're seeing, fever, cough, runny nose, body aches. The more serious symptoms that we take a little bit more serious is like new onset wheezing, having trouble breathing.
You know, one of the interesting questions that I got, and this was actually on our Facebook page here at News 12, is, by the way, folks, for those of you that would like to join us, if you have questions on Ebola or even the enterovirus, you can join us at 1-888-NEWS-12-NJ. Once again, it's 1-888-NEWS-12-NJ, and we'd love to put you on the air right now. One of the questions that I got, and this was on our Facebook page, I just had a flu shot. Is that going to prevent me from having Ebola?
No. The flu shot is a vaccine that protects against influenza and will not protect you against Ebola virus.
Two completely different things, obviously.
Two completely different viruses.
What, and Dr. Devidan, what about the cold and flu season this year relating to the enterovirus D68? Is it going to be worse? Is it going to become a real mess this year? I mean, the ER guys must be going crazy. I can't imagine working in the emergency room right now.
You know, first of all, I actually do suggest that the kids do get flu shots, all right? Especially the ones who are asthmatic, because the last thing you want to see is kids coming in with asthma, getting hit with the flu, and on top of it, getting hit with the enterovirus as well.
All right, here's a question for both of you. You're on a bus, and somebody's coughing. Do we throw the person off the bus? Do we cover our nose, cover our mouth? Do we go up to them and say, hey, you know, you really need to cover your face? How do we approach that? Because when somebody comes to the emergency room or somebody comes into our office, the first obvious question is, where have you traveled, right? If they haven't traveled to West Africa or perhaps to Spain or Germany or wherever, how do we separate this? How do we know what is what?
So obviously some of the symptoms can be very similar to someone who might have flu or enterovirus. However, the travel question is very, very important, and then a medical provider will assess that patient in terms of taking further history and examining that patient to really determine what the symptoms have been.
We've got another caller, so let's take this call. West Milford is our next stop here in New Jersey. Holly, good afternoon, and thank you for joining us today. What's your question?
Is there a high chance that Ebola is going to come to New Jersey?
So that's an excellent question. We obviously in New Jersey are in a state where there's a very large international airport called Newark, obviously, which has flights to
there all the time.
which has flights to West Africa. There are, as we speak, policies and procedures being put into place where persons who are traveling and arriving at Newark Airport would be questioned, particularly if they're coming from, obviously, countries that have Ebola cases, about whether they have a temperature, if they have been sick, if they have vomiting, if they have diarrhea,
and what are they
et cetera.
doing with those people? Let's say that the answer is yes, we've traveled from West Africa, they have a fever, they're coughing. What are we going to do?
So the recommendations are that they be quarantined and examined by a medical provider until it has been determined that that patient does not have Ebola.
And this is set in place now for travel at Newark Airport?
Those are the current recommendations, and it should be starting, if it has not started already, at all the international airports. It's highly recommended.
I know they've started that at Kennedy.
At JFK,
At
correct.
JFK, I know that's been
Correct.
started. We'll have to follow that up for Newark. I'm sure
I think
it's
that
all
would
part
be
of the same system.
Absolutely.
Anyway, we've got another caller from Hillside. Darryl, good afternoon. I keep forgetting it's afternoon.
Yes.
And thanks for joining us today. What's your question?
Hello, yes. I would like to know, are you putting yourself at risk by being frequent visitors to a African hair weave shop, by either being contaminated by the weave that is being sent from country to country, or by the merchant who's handling your child or the customer, whatever?
Mm-hmm. What are your thoughts on that? Sorry to cut you off there, Daryl. Go ahead.
So again, let me emphasize that the Ebola virus is spread by contact with a person who is infected with the virus. Yes, the virus can exist on hard surfaces. If a person who has the infection, let's say either their blood or their body secretions, ends up on the table, yes, we can find the virus in there. But in terms of the virus traveling thousands of miles on products such as hair weaves, which I think are made actually in some of the Far Eastern countries, and not in the African countries, but I may be wrong. But really the virus does not travel on inert objects. And again, the way you get infected is by being exposed to the secretions and body fluids of a person who's infected with the Ebola virus.
The thing that scares me is, how do we know?
Well, certainly there have been studies looking at this virus because it is so highly infectious, as we have seen in terms of the cases at the Dallas hospital. We know that it's highly infectious. So we certainly have looked at, there have been many studies that have looked at this virus and how long it lasts, let's say in someone who's died from Ebola infection. So we know that the body should be cremated because we know the virus can last in someone who has died from Ebola for a couple of days. We know it can also last on hard surfaces for maybe a couple of days, and particularly if there's blood. So obviously the cleanup in a hospital facility is extremely important.
And I think the cleanup everywhere and using those precautions, taking the precautions, I think is what is important. And by the way, folks, we're taking more of your questions on Ebola and enterovirus after the break. The number to call is... Thanks for staying with us on this special edition of 12 to Your Health. I'm Dr. Derek DeSilva. We're answering your questions about Ebola and enterovirus D68. Joining us today is once again Dr. Philip Devidan, the Pediatric Emergency Director at Chilton Memorial Hospital, and Dr. Patricia Whitley-Williams. She's a Pediatric Infectious Disease Specialist at Rutgers Robert Wood Johnson Medical School. The number once again to call us is 1-888-NEWS-12-NJ. I want to go to one of the questions that we just received on Facebook. And this, by the way, this is from Todd. If D68 has been around for years, since the early 60s, why is it in the news this year more than the others? Dr. Devidan, what are your thoughts on that?
I mean, the virus was noted in 1962 in California. And I mean, the reason we're seeing it more is, I just think that precautionary, you're getting more kids closer together in school, coughing, not really avoiding respiratory and hand hygiene. And with it, you know, you're also getting viruses that shift as well too. So each year we get a new strain of virus that causes the same complications.
Dr. Whitley-Williams, the issue of the second nurse being given some of the antibodies or blood from the first patient that had it and was treated, is this going to be the cure? Is it, or I shouldn't say the cure, the treatment?
Right. So there is no cure for Ebola infection. The treatment is mainly supportive care. So
which is?
So what happens with Ebola is there tends to be a lot of bleeding, so maybe people will need blood transfusions, sometimes the kidney fails, so they have to be on dialysis, etc. So this is a real problem with Ebola.
We're coming, I want to just get some final thoughts from you. Let's start with you, Dr. Devidan, first. How concerned are you, as a physician, about both of these viruses?
Not really. I mean, of course, these viruses are dangerous, but if we take the precautionary measures, if we take the proper history, these can all be avoided.
And same question to you, doctor.
I don't think I could have said it better. We should not panic about Ebola, but I think the basic things that we can do are good hand washing, pay attention. If you do have symptoms, please go see your healthcare provider.
Common sense, and at the end of the day, common sense.
Absolutely.
Yes.
Folks, by the way, to both of you, thank you so much for spending some time with us today. We really appreciate that. By the way, folks, for more information on Ebola and Enterovirus D68, head over to news12.com. There you can find some links to the numbers and resources. You can also reach out to me by sending an email to 12toyourhealth@news12.com or head over to my Facebook page and post your questions there. Once again, I want to thank both Dr. Philip Devidan and Dr. Patricia Whitley-Williams for joining us today. Thank you so much to all of you for spending some time with us on this special edition of 12 to Your Health. I'm Dr. Derek De Silva, and may you always be blessed with good health.